Hi, this is Dr. BJ with another counseling lesson. Today, we're going to learn about medication safety for elementary students. And one of the main reasons why we're learning about this today is because during the month of October, we learn about good drugs and we learn about bad drugs. So today, we're going to learn about good drugs. Let's find out what you know about good drugs. So, a quick fact check. Let's see if you know the answers to the following questions. True or false? Medicine is something you take when you are sick. True or false? And of course, yes, it is true. Medication is something that we take when we are sick, when we're injured, we need help due to an illness. And so we take medications to make us feel better. True or false? You can share your medicine with a friend. Let's say your friend is taking the same medication you're taking. Can't you just share it with them? True or false? No. Well, the reason why we do not share our medication with others is because the medication that they may be taking, even though it's the same thing, the strength or the dosage may be different. And you should never, ever share medication, even if it's the same, with another person, because that medication is specifically prescribed for you. I can take medicine as often as I want. Is that true or false? If I want to take one pill today or one teaspoon of my medication today, and how about 5 minutes later, I want to take some more, or an hour later, I want to take some more. Does it work that way? False. Yes, it is false. You should only take medication as prescribed by a doctor. And if it's one time a day, you take it one time a day. Another true or false question. Only take medicine from an adult you know and trust. True. Correct. That is true. Because an adult is responsible and they know when, how, what time you should take a medication. Definitely. I can take medicine to school and keep it in my book bag. Can I do that? True or false? False. And why is it false, students? Let's say, for instance, your friend or a classmate, they went into your book bag just because they're having fun and playing around and they found your medication and they decided to take it. That's not good. It can have an adverse or bad effect on them because that medication is not prescribed for them, as we talked about before. So always do what with your medication. If your parents send you to school with a pill or a bottle of medicine to take, you need to give it to who? If it's in your property. You need to give it to your teacher, or you need to give it to the clinic worker at your school. Give it to an adult. Okay? I think everyone did a great job. So let's talk about why you need to learn more about medication safety. Well, see, back in 2017, nearly 52, could you believe that? 52,000 children under the age of 6 were seen in emergency rooms for medicine poisoning. That's one child every 10 minutes. Isn't that a lot? So that means that this is very serious, and that's why everyone needs to learn about what we need to do in order to stay safe. And this is coming from safekids.org. What else? When do we take medication? So earlier when we did that quick fact check, true and false quiz, we learned about it. Do you remember when we take medication? Again, when we are sick, if we're hurt, or we need surgery, or we're even trying to stay healthy. So we take medication also to stay healthy. And we're going to learn a bit more about that later. By the way, how many of you love taking medication? I don't see any hands going up because I do not like taking medication. Okay. So who prescribes the medication for you? Does anyone know? I know. The doctor. Of course, the doctor prescribes the medication for you. When you're not feeling well, your parents take you to a doctor, and the doctor makes a decision if you have an illness and you need a prescription, which is for you to get your medication. So what do we call, how do we know what to take, right? We talked about that. What do we take? Well, anytime you see the doctor writing a little note on a little pad, and on that pad, he's writing what you should take, the name of the medication, how often you should take it, the strength it is, and any additional information you need to know about that medication. And that's called a prescription, right? We also know where we take the medication. And for those who don't, yes, we take the medication to a pharmacy. And at the pharmacy is where we fill the medication. But how do we know how much to take? Now remember, we know how much to take by what? The dosage, the amount of the medication, the name of the medication, all of that is written on the bottle of your medicine. And that's all you should take and nothing more. And there should be someone responsible for giving it to you, right? So let's think about a drug that, or you can purchase without a prescription. Does anyone know a drug that you can take without a prescription? I know you do. Over-the-counter medicine. So when we think of over-the-counter medicine, we think of something like Tylenol, Motrin, Benadryl, Advil. These are some examples of medication that a person can just walk into a pharmacy or Walmart or Walgreens or CVS, and they can go to a counter. It may be right in the front of the pharmacy, and there's just a litany. That means there are a lot of different types of medication that they can buy without a prescription. And Tylenol and Motrin and Advil and Benadryl, these are just some examples of them. And can you think of a time when you had to take Tylenol or Motrin? Think about it and share it with the class. So you can pause the video right here and share it with the class. Now, some of you may have said, when I was sick and I wasn't feeling well and I had a fever and it was my forehead was so hot and I had the shivers, or I had a runny nose and I needed something, and I had to blow my nose, or I have a cough. I had a cough, if that's a cough. But think about it. When you had these various illnesses that may not have required you to be hospitalized, your parents were able to get a non-prescription medication, which is over-the-counter medicine for you so you can feel better. So these are just some examples, right? How about, can I take the medicine myself? Now, there are some students who do take medicine by themselves, and let's find out how and why. First, it depends on your age and your maturity, the training that you've gotten on how to administer the medication yourself, and parent supervision for some students. Now, we have some students in schools that they have asthma and they have an inhaler and they don't need someone to supervise them, and there are others that do, because they know when they're having an asthma attack, they may carry an inhaler. Then we have some students who are diabetic and they carry medication also, or the clinic worker does, for them to take. And again, it depends on the age of the student, the maturity, training, and sometimes involve parent or adult supervision. So again, your parent can give you your medication, or someone you trust. It can also be a nurse, a doctor, or a clinic worker. These are just some of the fantastic people that will work with you and help you and show you what you need to do to take medication and why it's so important for you to take it as prescribed. Do you know a safe place to store medication in your home? Do you know a safe place? Where do you think you should store medication in your home? Let's think about that. How about in the fridge? Is that a safe place? How about on top of the bread tin? Let's find out where is a safe place. How about in a locked cabinet, right? Like this one here. And sometimes we have locked cabinets in our bathrooms at home or in the kitchen or in a locked medicine box like this one here. These are safe places to keep medication. So you may ask, well, why do we need to lock up medication? The reason why is because you may have a younger brother or sister that you don't want to come in contact with medicine that they should not be touching or using, okay? And the reason why is we don't want anything bad to happen to them. Do you know of an unsafe place to store medicine at home? So what is an unsafe place? The countertop, the kitchen countertop at home. We talk about the fridge. Don't we always go in and out of the fridge? So if you're going in and out of the fridge each day and the medicine is there, and let's say that's a medication you should not be taking, it's not a safe place for it to be. It should always be in a locked facility. So let's learn a little bit more about medicines. And we're going to learn the difference between how we can detect the difference between medication. Let's watch a short video on that. And this video is coming from Generation Prescription. Students, I want you to take out your little cards that have medicine on one side, and of course you're going to see it backward, but candy on the other side, okay? To play this short game. Are you ready?
Hi everyone, my name is Molly and I teach in the College of Pharmacy at Ohio State. So can someone here tell me what pharmacy is, or maybe even what a pharmacist does? Any ideas? Yeah. A pharmacist is someone that gives you medicine. What were you gonna say? That? Any different thoughts?
Not really, but a pharmacy is the place where you go.
Yeah, that's the place where the pharmacist works, right? So when we think of a pharmacist, we kind of think of them as a medicine expert, right? So they are responsible for preparing the medicine, giving it to the person that received permission from the doctor to take it. But most importantly, they teach that person how to safely use medicine, okay? So if a pharmacist is a medicine expert, what is medicine? Does anyone know what medicine is? Yeah.
It's something that like heals or helps somebody with like a problem they have in their body.
That is a perfect answer. Great job. Were you going to add anything to that?
I was just going to say it's a cure.
A cure? Those were all great answers. So like you said, a medicine is basically a substance used to treat illness or a sickness or maybe even an injury.
Yeah.
Okay. So who here has taken medicine before? Raise your hand. You've never taken medicine? Yeah, you took medicine. Yeah, so we probably all here have taken medicine before, right?
Yeah.
And where do we learn about medicine and how to use it safely? Do you guys have any ideas? What do you think?
The doctor might tell you how to
The
use
doc,
it.
exactly. The doctor is a great resource. What do you think?
You learn a little bit about it in school.
In school. So we have school, the doctor, any other places where we can learn more about how to safely use medicine? What about, yeah.
Your parents.
Your parents, exactly. So your parents or guardians are a great way to learn about how to safely use medicine. Okay, we're going to talk about the role parents play throughout our program. So we know what a medicine is,
Yeah.
right? We know what a pharmacist is. And now I'm going to tell you what we're all here to do today, and that is to earn your medication safety patrol badge. So when I say medication safety, we know what medicine is. What do you think medication safety means? Yeah.
Something that we can keep like if we have medicine, we can keep it safe.
Okay, so how to keep medicine safe? What were you gonna say?
Like know how to use it and like know when not to use it.
Exactly, that is a great answer. So it's basically all about how to safely use medicine. And it's important to know when to use it, how to use it correctly, when to not use it. All of those are great examples. And that's really important because while medicine can help us, if we are sick or ill, if we don't take it correctly and from a parent or a guardian, it can actually hurt us, okay? So we always want to make sure we're using medicine safely. So our first activity is called, is it candy or medicine? All right. So who here has taken candy? Raise your hand. Yeah, we've all taken candy, right?
Yes.
Okay. So do you guys think that candy and medicine look similar?
Yeah.
Sometimes it depends. Okay, so we're gonna find out, all right? So I'm gonna pass out the supplies for our game. Everyone's gonna get one of these cards.
So while she's passing out the supplies, if you do not have your cards ready, what you can do is, this is a C, and use this symbol for M, okay? So we can play.
So I'm going to show you a piece of paper that's going to have two photos on it, okay? And one of the photos is of medicine and one is of candy, but they're not labeled, all right? So it's your job to tell me which photo is medicine and which photo is candy, okay? So I'm gonna point to one of the photos, and if you think it's medicine, I want you to hold up your medicine card. So can everyone practice? Hold up your medicine card. Everyone know which one that is? That's right, okay. Now, if I point to the photo and you think it's candy, I want you to hold up your candy card. So let's practice. Everyone got their candy cards? All right. Everyone understand how to play the game? Okay, so let's go to our first picture. Okay, so here are two photos, and one is medicine and one is candy. So I'm just gonna point to one. I'm gonna point to this photo right here. What do you guys think that is?
What do you think? The one that she pointed to. What do you think? I think it's this one. Let's see.
Ooh, so we have some guesses are candy and some are medicine. Are you guys ready for the big reveal?
Yeah.
All right, here we go. So this was actually medicine. So who got that right? Okay, so tell me something. What was it about these two matches that made you think, oh, this is definitely medicine? What were you thinking?
It's big.
So why did you think it was medicine? Because we're going to talk a little bit about that. Think about why you chose medicine instead of candy, or why you thought it was candy instead of medicine. And share it with the class. Okay.
It's bigger. Okay, what were you thinking?
So when I looked at both of them, the candy, it looked like Smarties a lot. So then there I thought that one was medicine.
Okay, so you guys were able to kind of look at some of the differences between the two, right? But what was something that was similar? What's something similar between this medicine and candy match?
The medicine was bigger and the candy was smaller, and like probably have the same size.
Okay, so size, what were you gonna say?
They have the same color.
Okay, so I'm gonna go with
So size
color.
and color.
We're gonna come back to size in a minute,
Okay.
So one trait that medicine and candy share is that sometimes they can have the same color, like with this match, okay? So that's one trait that's similar between medicine and candy. All right, let's go to our next match. Okay, so do you guys see our two pictures? Are you ready?
Can y'all
I'm
see
gonna
it?
point to this one. What do you guys think?
The blue one, what do you think it is? I don't know. What do you think it is?
Ooh, we all agree that it's candy. Are you ready to see who right? Are you guys right? Yeah, you are. So why did you guys pick candy on that one?
Well, because that's kind of like a brighter blue color that's like more like roundish, kind of like a jelly bean. And then the other one you could tell was like kind of like flattish on the end.
So the kind of,
But like circle round.
Yeah, so this has like kind of a more rigid
Yeah.
appearance, and the candy's nice and shiny.
That was like uneven.
Right.
And
Mm-hmm.
that's
Okay. So we said one trait that medicine and candy share is they can have the same color. Okay. So you guys have pointed out some differences, right? But I want you to tell me what's something else that's similar between these two matches.
Hmm.
They're both
What do you think was similar? Okay, let's find out.
have like pill shapes, and they're like both blue.
The
Okay.
pill shape.
So you mentioned color again, but you also mentioned shape, right?
Yes.
So medicine and candy can have the same shape. Remember in the first match, both were circles, and now they both have kind of this oval shape. Okay, so now we know there's two traits that are similar, color and shape.
Color and shape.
All right, let's go to our next match. All right, so I'm gonna point to this one. What do you guys think?
I don't know. What do you think? Candy or medicine? Dun, dun, dun. Let's check and see.
Ooh, we have one thinks it's candy and everyone else thinks it's medicine. All right, let's see who's
Medicine?
right. So this is a medicine. And
Medicine.
this is candy. What do you think?
I thought that because those ones are bigger and they look like small ones.
The candy is bigger. Okay.
And those ones look like they were like they were flat
Uh-huh.
Flat.
and round.
Flat and
Flat and
round.
round.
What were you gonna say?
Okay.
So the Smarties and the inside are more like rounded in, sort of.
Yeah, so you guys are really familiar with that shape, aren't you? So we have identified, I think, 3 traits that make medicine and candy similar. Can someone tell me what's the first trait? What do we say? Size. Great.
Size.
Someone tell me another trait. Color. And what's our third trait?
Shape.
Shape.
Very good.
Right? So we know there's 3 things that make medicine and candy similar, but can someone tell me what makes them different?
Mhm.
Besides what we talked about while we were playing the game. I saw your hand first.
Probably the taste.
The taste? Okay, so the taste can definitely be different, right? What were you gonna say,
Where you
Trey?
can find them,
Where you find them. So where do you find medicine?
usually at like a pharmacy.
At the
or,
pharmacy.
like, you find like over the counter, like in a specific section.
Okay.
But you wouldn't find medicine right next to the Tic Tacs.
Right, exactly. What do you think? The smell. Okay. What's your thought?
Color.
Color. So sometimes the color can be different, but we also said that could also be similar, right? What's your thought? Texture. One final thought.
The packaging.
The packaging, right, the labeling information. What about, how does it affect your body? Does it affect your body in the same way? No. So when we eat
Let's stop here. So when we think about candy, when we're chewing on a chewing gum and we're eating candy, does taking medicine make us feel the same way? Because candy makes us feel good, and we like eating chocolate, and everything that is candy makes us feel good, put us in a happy place. Does medicine do the same thing for you? Yes or no? Think about that.
How does that make you feel? Hyper, yeah.
Candy.
Yeah, energetic, maybe kind of jittery. What about when we take medicine? How does that make you feel? It depends, exactly.
If you're sick, it could make you like feel better, and or
Yeah, so I like Charlie, right? I like Charlie's answer. He said it depends, right? So if we're sick, maybe that medicine, it may make us feel better, right? And help get rid of that sickness or illness.
Very
But
good.
medicine can actually do lots of different things in our bodies. And sometimes those things can help get rid of a sickness or an illness, but other times it might actually hurt our bodies if we don't take it correctly or take it from a parent or guardian. And that might actually make us more sick, okay? So while medicine and candy, they may look really similar, they act really differently in our bodies, all right? Are we all the same? Are we all unique? We're all unique and we're all different. And it turns out that medicine affects us each differently. If you and I have the same sickness, I might take a medicine, it may help me feel better, but it may actually hurt her body, make her feel worse, right? So only a doctor knows which medicine is best for us to take to ensure that it helps us and not hurt us. So that's why it's really important that we not share our medicine with others.
So remember.
And then my last rule is to ask a trusted adult to keep medicine in a safe place in their home, okay? So where could a safe place be where our moms or dads or guardians could store medicine?
Like in a top cupboard or something like that, in your kitchen or something.
Okay, and why did you say top?
Because, you know, like if you, like let's say you have a baby brother and you keep it in the bottom, he could like get in and start trying to eat that and stuff.
Really bad, right? Exactly. So we want our adults to store our medicines, and we actually prefer lockable spaces, actually, spaces that you can lock like a cabinet. If you don't have a lockable space, then a shelf that's very high where children and others who shouldn't be taking that medicine can't reach, okay?
Okay, so I hope you have learned a lot about how there are so many similarities between candy and medicine and what you can do to tell the difference. But this is the one thing I want you to remember about medicine. Always remember, if you are dealing or if you see any type of medication around you or something that you're not even sure of what it is, never take it. Always give it to an adult. If it's something that you should be taking, make sure it's a trusted adult that is giving it to you. Remember not to share your medication with anyone because doctors prescribe medication specifically for you. And if we want to be safe and healthy and strong and not want anyone to feel sick from taking someone else's medication, the best thing to do to stay safe is to take what belongs to you and you only, right? And again, we do not take our medication to school unless we're giving it to an adult for safekeeping, like your teacher or your clinic worker. I hope you've learned a lot today about medication safety, students, and remember to be safe. Have a wonderful, fantastic, awesome day. This has been Dr. BJ.